Hello, my name is Aaron Heber. I am a registered nurse. I am interested in applying for and pursuing the Family Nurse Practitioner route through Mount Carmel College of Nursing. I went to school at Ohio University. I graduated in the spring of 2017. To then, I went on to the Ohio Health Intermediate Fellowship, and then I was placed on an intermediate floor. I worked on this floor for approximately a year and a half, and then I made the transition to the ICU, where I've been on 5 Blue for the past 2 years. Through my experience working as a registered nurse, I have gained a wealth of knowledge as it pertains to taking care of sick individuals when they come into the hospital seeking treatment. When I first began working in the ICU, I found my knowledge being continuously tested, and I had to seek out new materials and question colleagues to just keep up with my education so I could adequately care for these sick individuals. I've always had a hunger for knowledge and learning, and always wanting to find new things to keep up with and to master. I found that working in the ICU, I had more autonomy than I was used to practicing on my old floor, and I found myself in situations with patients at times where I needed to think and I needed to think fast because at times their life would depend on it. Yet, even though in these stressful situations where a patient's life could be in danger, I would still have to seek out a nurse practitioner or a physician assistant that I worked with, and I needed to make sure that the practice that I was going to implement or the interventions that I was going to implement were the correct, and oftentimes they were the correct things to do, but I still needed their approval to do so. As a family nurse practitioner, you are an advanced practice nurse, and you get to not only assess patients, but you get to take it a step further than just being a registered nurse, and you get to treat these patients. And I found this enticing because I constantly found myself in the ICU wanting to do so, but having to get the approval before I could actually do that. So the ability to do this without having to get approval firsthand was another reason why I wanted to go back to school. Working in the hospital, and more specifically in the acute care setting, I feel that the aspect of healthcare and disease prevention unfortunately gets lost at times, because when a patient comes up, they could be battling an acute or an acute on chronic illness, where if you were able to go back to when they were first having signs or symptoms of this illness, if they would have had this measure implemented into their plan of care, I think it could take out them even having to come into the hospital. I feel that working as a family nurse practitioner, a big focus is on just preventing these illnesses and people having to even come into the hospital. And I would like to focus on that because I think I've seen the downwind or the long-term effects of disease, and I'd like to take care of it from the beginning to see if we can prevent illnesses from getting worse and hopefully treat people to get back to an optimized healthy lifestyle. To conclude, I have enjoyed my time as a nurse, and I will always be grateful for the knowledge I've attained working in the hospital in the acute care setting. But I feel it is now my purpose to pursue the family nurse practitioner track through Mount Carmel College of Nursing. Thank you for your time.